Hi, class of 2023. This is Dr. Shapiro. I'm going to give you a quick introduction to the PMP4 course. Well, welcome, of course. Now let's get right to things. So, what's PMP4? Well, first, it's your last classroom podiatry course. So, that's always a big yay. Of course, it also happens to be the course with a lot of advanced information in it. So that could be good or it could be a challenge. I think these topics are really interesting. So I'll say that the fact that it's advanced is good. Now, the general topics we're going to cover are four of them. We're going to be covering lower extremity trauma, soft tissue and bone tumors, Poto pediatrics, and then complications. So trauma is really interesting, and of course it plays into a lot of different things in both public and private life. This is a UFC MMA fighter named Tyron Woodley who was busy kicking his opponent, and you can see that he fractured his second, third, and fourth metatarsals, and he also had a Liz Frank fracture dislocation of his first metatarsal. We're going to learn a lot about that in this course. And you'll understand why Tyron Woodley is lucky to still be able to fight after this injury. He managed to fight 3 rounds on this foot, which is 15 minutes. He's a tough guy. So how about these 4 basketball players? They all have something in common, and it pertains to our course. They all have Achilles tendon injuries. And in the case of many basketball players, an Achilles tendon injury can have them out from 8 months to 10 months, and in a few cases, could even ruin their career. So what about tumors? Well, there are a lot of different kinds of tumors. There's bone tumors and soft tissue tumors. There's a tumor of almost any kind of tissue in the body, and we're going to be talking about these, and determining whether or not something is malignant or cancerous is going to be important. And when you're in practice, if you miss the diagnosis of a tumor and it turns out to be something you thought was benign but is actually malignant, you can kill the patient. So an example is the image on the right, where this is a ganglion cyst, which is a very common tumor of the foot, and that's a non-cancerous tumor. But it can be, in some cases, misinterpreted for a synovial sarcoma, and that is a deadly, highly malignant cancer that can kill a person, so we don't want to miss that. We're also going to cover Poto pediatrics, which is children's diseases of the foot and lower extremity. And as you can see in the picture here, this little girl had bilateral talipes equinovarus or clubfoot, and you can see that her feet are completely backwards. This is a patient that I saw when I was a resident back in, a long time ago, and this patient had bilateral foot surgery, and we basically turned her feet around in a very complex and long procedure that had her walking again after about 2 months. Completely changes people's lives to do this kind of work. So this is a different example of pathology. This child has something called vertical talus, which we're going to talk about, which is sort of the opposite of a clubfoot. And you can even see that this patient had prior surgery. You can see the scar along the medial and the ankle and the dorsal foot. And really, really difficult. The fact that they've had prior surgery shows just how difficult these things are to treat. Then, of course, we're going to also talk about the perioperative issues that are involved with taking care of kids. It's one thing to fix the clubfoot or the deformity, and it's a whole other thing to keep the kid alive during the surgery. So that's going to be part of what we're talking about in this course. We're also going to be talking about complications, and there are a variety of potential complications that can occur as a result of problems. This patient that this lateral foot X-ray or ankle X-ray that you can see had this patient was had an ankle fusion after a car accident, and her complication was long-term ankle arthritis. She was then fused in a plantar flex position, which is not functional, which is another complication of a surgery. She then subsequently went on to have a pantalar fusion by me in order to bring her back to a limb that was that she could walk on. It wasn't functional like yours and mine are, but she could walk on it. And then we're also going to talk about medical complications. So, of course, perioperatively, again, there are a variety of complications that can occur with our very sick patients that we have. And these things can include anything from pulmonary emboli to heart attacks to blood clots to urinary problems. I mean, the complications are pretty significant, and your understanding of these patients will be a benefit to you and your patients when you're in practice. Okay, so let's talk about a little bit of housekeeping. Let's get to the specifics of the course. So obviously, I'm your block lead, and you can see my email address. I think you all already know that. Here's some information about the syllabus. So let me suggest to you that the syllabus is an important document for your course, which is why I gave it to you before the course even started, and I suggest taking a look at it. You'll notice that in the image from this Google search, that the 100 best books in the 21st century by The Guardian actually found PMP 4 in there. Imagine that. So our syllabus is one of the 100 best books in the 21st century. What do you think about that? So the syllabus is going to include things like learning objectives, and we're going to test you based on those learning objectives. The overall format of the course is in there, as well as policies, how we grade, and the course schedule itself is also going to be in there as well. And, of course, since it's one of the 100 best books of the 21st century, then you might want to read it. Okay, so here is an example of the course learning objectives. I kept them kind of broad so that you'll understand that there are a variety of pieces of information that you need to know about the specific topics. So you can see here with Poto pediatrics, it includes all of these different pathologies and topics, and within each one of them are things like the pathological anatomy, the pathophys, differentials when that's important, surgical treatments, and those types of things. There are course learning objectives for each of the 4 major sections of the course. So what about the overall structure of the course? Well, this is a 10-week course. And why it's 10 weeks has a lot to do with COVID and the way that the classes were scheduled. This is generally a course that's a little bit longer than that, but we can get this done in 10 weeks, and we're not going to extend the course to enter into your study time for boards. So we're going to keep this 10 weeks. So again, we have 4 major topic sections. We're going to use a flipped classroom format, and that will require us to use the recorded sessions. And I mentioned this in a previous email to you guys that we will use the recorded sessions. I have listened and watched all of the sessions that are recorded, and I think they are usable for us for this class. Now, in order to have a successful flipped classroom format, that means you're presented with information outside of the normal class time, and I calculated your class time based off of using those recorded sessions as in your class time. So it's not extra besides what you're going to be doing in class. It's actually calculated into the overall class time so as not to overload you. So you watch the recorded sessions, and then we're going to have online reviews and Q&A sessions to help to build your knowledge and have you answer be able to answer the questions for exams and also understand this material. So there are no in-person workshops. They'll all be online. And there are a couple of physical exam workshops, one for trauma and one for Poto Peds, which we will include into your third year at the beginning. So don't worry, you're still going to be able to get those as well. So if you look at the course schedule, you can kind of see how things are broken up. By unit, you have trauma with fundamentals, forefoot, peds, midfoot, rear foot, and then each week. And you'll notice that the date only shows the week currently. It does not show the exact days. And the reason for that is that I have not received the days of your shared curriculum classes. And so I'm going to do my best to make sure that there is no overlap between your shared curriculum and this course, so you don't miss material during your shared courses, and this can occur outside of the normal scheduled time of your shared curriculum. Then you'll also see the topic, the format of how it's being presented to you, and then how you can prepare for that. Now, it will look like a very large number of lectures, but keep in mind that each of the lectures was broken up into multiple pieces so as to be shorter and a little easier to watch. So, for example, in week 2, you can see that nail trauma, digital sesamoid fractures, metatarsal fractures, and fifth metatarsal fractures, as well as Lisfranc fractures, are all part of one larger original lecture that we have broken up into smaller multiple ones. And I have to tell you, after having watched these, I love the fact that they're a lot shorter for each one because, gosh, watching one of these lectures all the way through, it can be exhausting. This will also give you the chance to watch things beforehand and to rewind things a little bit easier. So keep that in mind. And then I have already included for you lecture links to all of the lectures that currently exist. And as these are not going through Elentra, I've noticed that they are usable in the sense that you can click in different parts of the individual slide and move things forward, back, and pause it. And it's a little bit more workable than the prior complaints I'd heard about not being having to go back to the beginning of a slide in order to listen to any part of it. So hopefully this should solve that problem for you. Okay, so I just wanted to mention again why the class is structured how it is. This is a picture of me at the somewhat beginning of the COVID pandemic. And yeah, just like for you, COVID really sucks for me too. My personal life has been wrecked. My professional practice life has been wrecked to some extent. I've had some patients die from COVID. This has just been an absolutely terrible pandemic. So if you're alive and you're able to, study and become a physician at this time, yeah, it's not great to have to be stuck at home and to do online everything, but it sure is better than the alternative. So I'm consider myself blessed and just to be able to continue to be a podiatrist and take care of patients the best I can, because it sure could be a lot worse. So as a result of COVID, as you're aware, more so than me probably, the shared curriculum has been completely renovated and changed. And this has required me to use a flipped classroom format. And it's actually an improvement to use a flipped classroom. So the whole idea of a flipped classroom is that you don't spend all your time in class listening to me or some other professional speaker blather on and give you passively the information. Instead, you get those lectures outside of the normal class time. And if you do this right and you actually study and you listen to those lectures before our other planned sessions, then you will retain the information better than if I had just, spoon-fed you the information. So this gives you a chance to do something with it, to ask questions, and to become better than you could have been. So Let's take a really bad situation and turn it into something positive. Okay, so what are we going to do with this class? I mentioned to you no hands-on workshops. You're going to watch the recorded lectures before the review sessions. Then you're going to participate in multiple review sessions, and I will have as many of those as we can, at least within the time frame allowed. So we'll have review material, Q&A. We'll do workshops online. A lot of the material here is possible to do workshops online. There'll be a little bit of outside reading, not a ton. We used to have a syllabus for this, like a large primer for this course, which I am not going to force you to read. And for things that have outside reading, I'm going to let you know what to focus on with reading and what the test material is going to cover. There'll also be your own special podcast that I'm going to create for you. This will be voluntary, but it will be helpful for you. So let's talk about that a little bit. Your podcast is called Pimp My POD. So this is our logo for this. These are going to be approximately 30 minutes and maybe a little bit more, a little bit less, depending on the topic. These will come out weekly, and the content of these will include some of my own thoughts, philosophies, and some advice to you. We'll reinforce the material that's covered in that particular week. I will give you some helpful hints for quizzes and tests. And I will promise to do my best to have this as both educational and entertaining as I can. I am not a professional podcaster, but I have a pretty big mouth, so maybe that'll help. I can't promise that these will be the highest quality recordings, and I don't have a video person who's an expert at processing these things, so we'll do our best with this. Hopefully they won't be too bad, but at the same time, they'll give you a little bit of something that helps you understand what you're learning in a reasonably interesting way. So, Pimp My Pod, that's our podcast. Okay, how are you going to be assessed for this class? Well, it's very simple. You're going to have two major exams, a midterm and a final. The midterm is going to cover trauma and Poto pediatrics, the first two sections, and the final is going to cover tumors and complications, the last two sections. The exams will not be comprehensive. So the midterm just has the two sections, the final has the two sections. Both of those together are going to be 80% of your grade. We're going to have quizzes on this as well, and those dates are listed in your syllabus. There are 11 quizzes total. The worst 4 of those quiz grades will be dropped. If it turns out that for some reason we have to adjust the timing of the class in any way, then maybe we'll end up with 10 quizzes and I will drop the 5 worst or something like that. Okay, so we'll kind of see how that goes. Those quizzes will be 20% of your grade. And I'm told by the college that there will be a 6% curve applied to the overall course percentage, and that's our COVID-19 curve. So my goal is that all of you get A's in this class. So let's see what happens. Okay, so let's talk a little bit about my philosophy about this course and how to get something out of it, okay? So there are two things that I would really like you to get out of this course. The first one is I want you to earn a good grade. So yeah, I want everybody to get an A. If that's at all possible, great. Okay, there isn't a curve in this class in the sense that somebody's going to fail, somebody's going to get a 70, and someone's going to blow the curve and get 100%. I want everybody to be successful. Let's aim for that. But good grades are good, but it's more important as a physician that you actually learn this stuff. You have to treat patients. You're going to have human beings who are relying on your knowledge. And without having a good sense of knowledge, you're a useless doctor. So if you don't know your shit, you're crap as a doctor. So sorry, but I want you to learn, and that's the most important thing. Now, of course, there's nothing wrong with us having a little bit of fun also. So if we can make this fun, great. All right, I'm all for it. And I want you to let me know anything I can do to help make this course as fun and interesting and educational as we can. So in order to also help you, I want to tell you just a little bit about exam questions. They're mostly first order with some thinking processes that go along with it, but none of these are meant to trick you. Okay, so I'm not trying to have you memorize what third word in some lecture was said and just switch that word around in order to make an exam question. So here's an example of a exam questions from a trauma section. I mentioned to you that you're going to get lots of hints about what's on tests. So if you were smart enough to watch this, then you've got a hint for one of the test questions. So here's a question. While in your emergency room rotation, you're asked to see a patient who has just been brought into the ED with a crush fracture to his left foot after a motor vehicle accident. He's unconscious and breathing irregularly. His left foot is purple with an open lesion, and the first metatarsal head is sticking out of it. Which of the following principles should guide your care? Okay, so this would require you to know the basics of trauma principles. You'll kind of need to understand a little bit about open fractures and those kinds of things, and you'll see that everything here is something that should be done to guide your care. So not that difficult. If you know about trauma principles, then you'll get this question easy as pie. So here's another one. So this is from the Poto section. Is this a fracture or an ossicle? So you can see the blue circle there, and you'll learn in this course that ossicles are highly common, and ossicles are oftentimes smooth and rounded. They show up in many very specific places, where fractures are kind of jagged and irregular. And so this one is an ossicle. Okay, so that's it. That's the kind of question that you're going to get. There are a bunch of classifications that we're going to cover in this class, and you're going to have to know those classifications as well. Okay, so I'd like to ask you to maintain good communication, both with me and with each other, of course. If you have significant complaints or concerns about something, let your class rep know, and they can get in touch with me. You're also welcome to contact me directly as well, and I will be as open as I can to make any adjustments possible to the course. I think you'll find as time goes by with this course, you won't have to do too much of that kind of thing. Now, what I'm not going to listen to is a bunch of whining. So when you communicate with me, if you have a complaint or a criticism, I want you to also have a solution, or at least an idea or a recommendation that I can try to institute for you. So that's the way you communicate. You have a problem, and you suggest a solution or a recommendation, and I promise you that I will do my best to help with that. So how do you succeed? This is the last kind of section here. It's important to know. So the first thing is study a little bit at a time. If you procrastinate, you're going to get demolished in this class. It's 10 weeks. The material can be challenging, especially you'll see when you get to bone tumors. It's very hard material. It's not something that everybody memorizes really easily. So study, make sure you've watched the videos, take notes, prepare, especially before the review sessions. When you are studying well, you will have questions to ask during the Q&A parts of review sessions. If you don't have questions to ask, then you're not studying right. Okay, so when you are confused, ask questions. I'm happy to go over things. Give me notice if you want to meet with me individually. I'm okay with that. We can meet by Zoom. That's probably going to be the only way we can meet currently because of social distancing issues with our clinic. But if you give me a little bit of notice, we can schedule a time to meet. And I'm okay meeting all kinds of weird hours, weekends, after hours, before hours. It's okay. Whatever you want, I will do my best to meet that need. So I check my email several times a day. There it is. And in an absolute emergency, you can call my cell. That's what that number is. So feel free to keep that number and you call me if you need me. Okay, so that covers it for the class. Feel free to let me know if you have any questions. And again, if you put in a reasonable amount of effort into this class, I think you're going to do great. I think you'll like the class and the content. It's all really interesting stuff. And we're so close to getting you into the clinic. We have all kinds of things planned for your third year, and I think you're going to do fabulous. So I'll see you in our next meeting.